Hello and welcome to another Facebook Live broadcast with Medstar Health. My name is Michelle Bowman-Carter, and today I'm joined by Rebecca Schumer, a physical therapist at our Hunt Valley location. Since October is Physical Therapy Awareness Month, today we're going to be discussing the various tools or modalities in physical therapy and how they may help reduce pain and improve healing. So if you'd like to learn more, give us a like to let us know that you're watching. Stick around and share this broadcast with your friends and ask us your questions in the comments below. We're going to take some time to answer those as well. So Rebecca, welcome and thank you for joining us. We really appreciate you taking the time to speak with us today and educate our viewers. Before we get started with our questions, could you tell our viewers a little bit about yourself and the work you do here at Medstar Health?
Sure, thanks for having me. I've been with Medstar since I graduated 11.5 years ago. I am currently the clinic coordinator up in our Sparks location inside US Lacrosse headquarters. Here we treat mostly athletes, but we also see general population as well, be it post-surgical or the weekend warrior, pretty much any orthopedic injury we can treat here. So I've been in PT for 11.5 years and seen a whole spectrum treating from the 9-year-old all the way up to 95-year-old, everything in between.
Wow, awesome. Thanks again for joining us. So let's begin. I want to talk about physical therapy. So what do most people think about when they hear physical therapy? What is the usual response or assumptions?
That is a great question. So sometimes we get patients that didn't start with us and they've transferred to us, and that's kind of one good picture of what they think it is. So it's anywhere from I'm on the table doing exercises the entire time to I'm up on my feet exercising. So it really depends on where you go, just like any other profession. Different PTs treat different ways. So it really depends on what your injury is and the PT that you're seeing and what they specialize in. But the goal is so that American Physical Therapy Association, they have a vision statement, and it's basically to transform society to optimize movement to improve the overall human performance and experience. So basically we're trying to get you to move the best that you can in the safest way possible. So that's kind of the summary of what PT does.
Great, thank you. Would you mind talking to us a little bit about instrument-assisted soft tissue mobilization? It's a long term, but could you explain and share how it works?
Absolutely. So I'm going to kind of go over a bunch of different modalities here. That's kind of what we're starting with. Some of these may be new to you. They may be known as other names. So the instrument-assisted soft tissue mobilization. Some people know it similarly as Graston tools. That's a little more aggressive way that they have their own certification. This one is just these basic tools, these metal tools here. They all have different edges, depending on the treatment effect that you're trying to get. So I'm gonna have Kelly come over here to kind of show you what it's like. Talk about cupping in a second as well. They're kind of the same purpose. Basically, we're trying to get the tissue to move better. So basically what we do is get a little lotion. Say if her quad muscle here is tight, just put a little lotion on. And I use this, they all again have different edges, and then we just kind of scrape down. Now what you can't feel, what Kelly can feel is these like little gravelly spots. So it'd be nice and smooth, but on a tissue that's not super happy, you're gonna feel kind of bumpiness. So the cool thing about this is the patient can give you feedback on what they're feeling versus just generally like massaging. You can't appreciate that texture difference. So if we keep going, it's gonna get a little red. And that's kind of our indication we're getting some good blood flow to the area. The goal is not to bruise her. That means you're pushing too hard and doing it too much. But the idea is to open up all these tissues in order for her to be able to bend her knee better and activate her quad muscle better. So that is ISIM for short.
Thank you. Would you mind also demonstrating myofascial decompression? People may also know it as cupping, and it's been used in sports medicine by the USA swim team for several years now. But could you give a demonstration of that, please?
Sure. So I'm going to grab this little kit over here. So they have different sizes depending on what body part you're going for. So they have big ones all the way to these little tiny ones. Cupping can be used in many different ways. So you can literally just put them on somebody, leave them on, just let them marinate, or you can do it for a shorter amount of time. So you put this on, I'll show you in a second, and you can actually have her move as well. So it really depends on what effect you're trying to get. I'm sure you've all seen like the big purple spots that are on
right.
Like, popular. Again, the goal is not to necessarily like have a big bruise area. The goal is just to get some blood flow to the area. So less is actually more. So all you do is stick this little thing on a muscle. You hook up, I'll hook this up first. And what you're gonna see is, I don't know if you can see it, but like the skin's kind of puffing up in here. You see that?
Mm-hmm.
So it's like rounding. I'm gonna take this off. You can see it kind of stays there. So if I had lotion, I'd be able to like kind of move this around. So say like you had issues with flexing or extending her wrist or bending and flexing her elbow, by kind of moving this issue around it, theoretically it should allow her to move through better range of motion. So again, different purposes for using these. A lot of people use them on the shoulder, the upper extremity, or the quad, bigger muscle, less so down here on the arm, but that's a general idea. So don't need to go very aggressive with it. Less is more, just trying to get blood flow to the area and make the tissues move better. So that's cupping.
All right. And a quick question along related to cupping. How long is a typical treatment for that?
So if Kelly were coming to me to have cupping done, again, there's different reasons. So if it was like a lower back, she's been having back problems, muscular pain for a while, I might leave them on for 10 minutes. Versus like someone that's not as acutely in pain, I might leave it on for say a minute or two, or just kind of move it around for 30 seconds to a minute. So it really depends on the treatment goal, what you're trying to get out of it.
Okay, perfect. Thank you.
Yeah.
I have another question about probably another tool in your toolbox. What is electrical stimulation and how have they been used in your clinic?
So e-stim, electric stim is very, very popular. Again, there's a million different ways to use e-stim. Most people know it as like you put the 4 pads on, which I have 2 pads here, but so if you've ever had knee pain, you've been to PT and you've had stim before, they typically surround the knee. So they kind of create a crisscross pattern. Then we turn this machine on and it gets it to kind of tingle. So I don't know if you've ever like banged your shin against something, you rub it, it feels better. That's kind of what we're trying to do from a pain response. So we're tricking your brain into having a happy stimulus to reduce the pain. So if we're using it in that way, we'd use it towards the end of the session. We see a lot of athletes here and treat a lot of athletes post ACL surgery. So what we do for that is we use this to help the muscles turn on. So after the surgery, these quad muscles kind of get sleepy, and that prevents them from walking normally, from getting the range of motion back. It's very, very important to get those muscles fired. So I'm going to demonstrate what this looks like. Let's use it in this way. So this is the quad muscle here. If she pushes down, the knee gets nice and straight. Now, after surgery, if you have knee pain, she's not gonna be able to do that as well. Right. So pads on. So one on the, it's called the VMO, the inside quad muscle. One more towards the middle. Bear with me, it'll take a second to set this up. Okay, so we're gonna do something called Russian stim. So it's gonna go on for about 10 seconds and it's gonna go off for 5 seconds.
Okay.
So first what we do is we just ask the patient to tell us when you start to feel a little tingling or twitchy sensation. So we're gonna eventually say, okay, let me know what it's like. What we wanna see is this muscle actually contract. There's no special number, just going until we get a good contraction. Mm-hmm. There it is. Can you see it on the camera? Mm-hmm. Kind of getting like tighter.
Right.
So what we do is we use this functionally. So when this beeps and it turns on, she's going to actively do an exercise with it. So it reminds her brain, okay, when this is on, it's supposed to tighten. So we get the muscular contraction, we get the range of motion. So we use it as a combination, not just like a passive treatment. So when it's on, she's pushing down, you can see her quad gets nice and tight. Good. So that's one way to use it. Sometimes after surgery again, and like your brain kind of forgets how to turn your muscles on. I know it sounds kind of weird. You can try really hard and sometimes it just doesn't fire correctly. This is a great feedback tool. So she can feel like, oh, this is where I'm supposed to feel it. This is when I'm supposed to fire it. Another cool thing we can do is just a different kind of stim. There's so many different kinds, but this one, the stim actually stays on the whole time. So it's much less aggressive than what we just did. But this one's a little more passive. She can just hang out. We're going to eventually see this muscle just twitch. You feel it yet?
Starting to.
There we go. See
that? A little twitch, yeah.
So this one I'll usually leave on for longer, like 10, 15 minutes or so. Just get the muscles firing. It's kind of a timing thing. So the stim is the pattern that's connected to the machine simulates what it like when you're actually contracting your muscle in real life. So again, it's good for the brain just to remember, oh, this is what this contraction is supposed to feel like. So that is that type of stim. So again, you can use stim, e-stim for pain control to help get the muscles firing. You can even use it to help with swelling. So there's lots of different purposes for this. It's a really great tool. So
Thank you very much, Rebecca, for that demonstration. And thank you, Kelly, for taking part in this as well. If you're just tuning in, thank you very much for joining us. My name is Myofascial Bowman-Carter, and today we're discussing physical therapy with physical therapist Rebecca Schumer. She's showing a lot of the tools that she uses in her toolbox for treating patients with orthopedic and musculoskeletal injuries. We have more to talk about today, so stick around, share this broadcast with your friends. And if you have any questions along the way, please share them in the comments below. We're going to take some time to answer those as well. So back to a few questions that I have. I want to talk about dry needling now. It's another modality that is pretty popular. It's also compared to acupuncture, I guess, because they both use some type of needles, but are they the same? And if so, could you elaborate on that or explain the differences?
Sure, I could talk hours for this, so I'm going to try to be as possible. The similarity between dry needling and acupuncture is the actual needle. So we use the same monofilament needle. They come in all different sizes. So we have the bigger ones to get into a deeper area. We have small ones, all different sizes. The acupuncture, it's more Eastern medicine. So they're going off chakras, kind of balancing your energy systems, as opposed to dry needling. We're sticking it into tight trigger points. So trigger points are like tight points in different muscles throughout your body that you push them and it kind of hurts. So our goal as a PT performing dry needling is to insert the needle into that tight band of muscle to get it to relax. You can also work the other way to kind of fire the muscle up to get to stimulate. So it kind of works two different ways. It's very effective in muscles that have been tight for a while, trying to loosen them up versus like massage. A dry needle can loosen things up very fast. Also for patients with back pain, anyone having trouble firing muscles down their arms or their legs, it's like hitting the control on your computer, so it reboots your system. It's not a fix though, so if you just reboot your computer, you don't upgrade your system, then you're still going to have the issues. So we start with trying to create a good environment and then couple that with exercises to reinforce what we're trying to get across. So you can pretty much dry needle any muscle in the body. You have to be certified to perform it as a physical therapist in the state of Maryland. So not everyone can perform it, but it's a very, very effective tool. We use it all the time. So I'm going to demonstrate on Kelly's calf muscle or quad. Do you have a preference?
No.
I would do the quads.
Okay.
All right. Let's see. So we have gloves here. We have to be sterile. Can I trouble you to grab me the white foam roller if it's on top of the shelf over there? Yep. All right, so slide down underneath her knee. So normally I would have someone sign a consent form. We'd go over all the risks. There's contraindications, reason why we wouldn't do this, why we would. So yeah, so get the permission first. It's called dry needle because I'm not inserting any medication. So clean her leg off here. We'll find a good spot. Kelly's a great sport.
Yes, she is.
So there's also different techniques for dry needling. You can use the stim like we just talked about, which I'm going to show you. You can also use what's called a pistoning technique without the stim, where you just put the needle in and kind of move it around. What we might see when we put the needle in is like the muscle might twitch, which is a really good response. Okay. So think of a trigger point as almost like a area of congestion. So it's a bunch of bad stuff that we just need to like release and get out. Okay. Most people are not too sore from this. If you are, it's possibly just from the chemicals, like the bad stuff kind of getting released. But it doesn't feel any more like anything worse than workouts, like a hard workout, and it shouldn't last more than 12 to 24 hours if you feel anything at all. So this is the stim unit, so it's different than that stim unit. Just gonna put one in and then we will attach it. So again, there's different sizes depending on what body part you're on. So first I'm just gonna kind of feel for a spot that might be tight. Hope you have some. You're actually not too tight.
No, I'm doing okay.
You're doing great. All right, so once you kind of find your spot, take the needle, put it on the skin. Some people like a countdown, 3, 2, 1, in, put it in, and that's it.
Okay.
Not a peep out of Kelly.
It doesn't seem like it hurt too much.
It gets it bad. Really not as bad as people say it is. Kind of, this is a grounder, so I'm going to tuck that in. So we're creating like a circuit. So same as that stim. I'm going to put this on slowly, and we're going to eventually see the muscle kind of jump. I'm going very slowly because if you turn it up too fast, it's not going to be super comfortable. You can start seeing it. You see it? So that is.
Yeah, I see that now. How does that feel, Kelly?
It just feels like I'm having like a muscle contraction. It doesn't hurt. It just feels like my muscle's moving and I'm not doing it.
So happy muscles have a consistent heartbeat, like a thump. This is kind of like a speedy one. So either I can leave this on until it kind of dies down a little bit. Sometimes in muscles that are really, really angry, I can leave it on, not change any setting, and then muscle will eventually just give in, which is really good. It means it relaxes completely.
Okay.
So I'm going to turn this off. Get out the area, and that is dry needling for you. So again, you can do it, and we're trained to do it in pretty much any muscle in the body. We use it a lot for patients with like low back pain, neck pain. If you just had a surgery, we can't do it for 6 to 12 weeks around that area. Okay. Do it around it, and it just increases blood flow, breaks up trigger points, and just makes things move better, much more quickly than necessarily like a massage would.
Absolutely. That's very interesting.
Yeah,
thank you very much. Thanks again for the demo. That was really cool. So what if you are a seasoned athlete and have a devastating injury? How does a tool like blood flow restriction work, and how does it help with recovery?
So blood flow restriction training is one of my favorite tools. What it does is this cool little box. Now there's different methods of doing it. This is the Owens recovery science, which I'm trained in. This is the same unit that they use in the OR when you have surgery and they put a tourniquet around your leg. Same unit. So what the idea is, we put a blood pressure cuff on the thigh or the upper arm to occlude in the leg 80% of the blood flow going down, and in the arm 50% of the blood flow going down. What that does is when you exercise with that on you, and even if you're just sitting still with it just pumped up, it creates this environment for building muscle. So your growth hormone, which stimulates muscle growth, is kicked up hugely. Protein synthesis, which builds your muscles, kicked up. the stuff that breaks down your muscle called myostatin, that's decreased. So there's a lot of like chemical effects going on. It's really backed up by research that shows the benefits. So basically, she had a knee surgery. By putting the blood pressure cuff on her leg, she can work out and still hopefully reduce muscle loss, and if not gain strength, without stressing the actual joint. So it's a really good workout. But the cool thing is you can still lift, maintain your strength when you can't put weight on your leg, or when your joint is healing, you can't load it. So hugely, hugely effective. There are different size cuffs. So all the way from this guy to this one. So this one would be for the arm. So what you do is we put this blood pressure cuff, I'm not going to blow it up all the way, but basically this would go around her thigh. Thank you. So it would go all the way up, and then you don't have to lie down, but we would hook this up to here. She would lie back, and then we would take her blood pressure. That's really, really important. I'm sure you've seen people, maybe you've seen people at the gym where they just tie things around their leg or their arm. That is not safe to do. You really need to get your own personalized blood pressure so you know how much to cut off. Some of the bands that they sell online, they're very, very thin. You can see this is pretty thick and consistent all the way around. That's to protect your vascular structures. So if you're doing something that's too thin and too tight, you can compromise your nerves, your veins, and your arteries. So it's really, really important not to mess with this at home. Make sure you have like a skilled provider showing you how to do it. Once this is blown up, it gets really tight, very, very tight. And when it's on, we're doing 75 reps of exercises. So it's a lot. So the first 30, and that's just to get all the oxygen out of the leg, followed by 3 sets of 15. So it's a lot. It's very, very hard. Some people love it. Some people don't like it. But it's extremely effective, again, to reduce losing your muscle after surgery, or even I've treated patients 6 months to a year post-op who still have like a smaller quad. They use this for 4 to 6 weeks, and it can help grow it pretty significantly in a short period of time. So it's also, there's tons of studies for the elderly population. Even just someone has a hip fracture, just putting this on and having them sit there, they still get the benefits. You know, if someone falls and breaks their hip in their 90s, that could be a devastating injury. So they're trying to find ways to maintain strength without stressing that area. So blood flow restriction training is not just for athletes, it's really for anybody. And it's highly, highly effective. So
great.
Love the book.
Thank you very much, Rebecca. Let's now talk about hot and cold therapy. Could you elaborate on that and share how it's beneficial for patients?
Sure. Just in general, for ice, I would use it more acutely in that like day 0, the injury just happened, to 10 days post. Sometimes if an athlete is working out longer and like the knee is swelling up, which means you're probably doing too much anyway, I might put it on at the end of the session, but really you only want to use that in the acute phase. If a patient comes in, their knee is super stiff, we work them out, they're all loose. At the end of the session, I don't want to put ice on them and lock them up. So really it's used for reducing inflammation early on in the acute injury or post-op early on. Heat is more for stuff that's not acute. So if, you know, someone's had back pain for years, kind of loosen their muscles up and get them moving better from the start, that's when I would use heat. So either to start a session or to end a session. But we have really cool devices for ice and heat as well. So we have this, slide it over. There's a lot of different ice machines. A lot of people get a machine for their home that's similar to this. It doesn't necessarily have the compression, but this is just a knee sleeve. So she just had surgery. We just had a good session. We want to reduce any inflammation, help her recover faster. Slide this guy on. And then we hook this up, which connects to this machine, which has ice in it, ice and water. And it creates this cool pumping action. We're not plugged in, so I'm not gonna. It makes cool noises, but we'll leave that there. But basically it's helping, it's not just cold, it also has the pneumatic compression part, which pumps some of that swelling out at the end of the session. So just helps her recover a little faster. Had she not been using it, just helps us get ahead of the game. So that's the brief hot versus cold when I would use it.
Perfect. Thank you very much. Speaking of compression, could you explain vasopneumatic compression, also known as the Normatec devices that some of us may have seen on television? Could you share more about that compression, the devices, and how they're used in therapy today?
So instead of ice, we use ice to kind of constrict and kind of reduce inflammation. It's really the pneumatic part that we've been missing a little bit. So this machine is really, really cool because it helps pump out any extra fluid that is residual in the leg or the arm after a session, after a workout, after a surgery, really anything. So the cool thing about this, it's huge, it has different compartments. I don't know if you can see like the zippers here, the different lines.
Yes. Mm-hmm.
So what this does is, so she'll slide her leg in here. This one's a little long for Kelly. All right, so what it does is it starts pumping from down to up to higher. It has different compartments in it. So it'll keep this one tight, and then it'll go up to this one, up to this one, up to this one. So it kind of like pumps the fluid out. So you'll see a lot of the professional athletes using these for recovery to help just flush out the legs after a hard workout. You might see it in like a baseball player, use them for their arm, same idea. It just helps a lot with feeling better, reducing soreness after a good workout. They're not too uncomfortable. It has different levels, so it can different like levels of tightness it gets to. So depending on if you're post-op, you might not want it as hard, versus like an athlete just had a hard workout, they might be able to tolerate a higher level. But the idea is it just pumps, works its way up, gets the fluid out so that everything can kind of heal much more quickly with less pain. So that is the Normatec or the vasopneumatic devices.
Great. Thank you, Rebecca and Kelly as well. We have a question from a member of our audience. So I'm going to turn it over to him. This question comes from Tim. He says, I went to physical therapy for 13 weeks and he didn't get any exercises to continue when he completed physical therapy. And he wanted to know why. So could you give an explanation for that, or share, if he needs to do any exercises this long after his injury?
Sure. So one of the cool things about PT is arming people with education and kind of taking ownership of their injury and understanding like why it happens and hopefully reduce it happening again. I can't speak to where Tim had physical therapy, but I always make sure my patients have a whole plan, and we call it like a maintenance plan. So once they kind of calm down, they're back to doing what they love to do, I'll usually give a home program to continue, even if it's once or twice a week, or like if you start feeling something, this would be the go-to. Just so you can arm yourself and know like kind of how to manage it thereafter.
Okay.
Can't speak to why he wasn't given things to do, but you could always touch base with a physical therapist and ask for some things as well, if you're interested in kind of maintaining a program. So
great, thank you very much. As we bring this broadcast to a close, I just want to ask, what final message do you have for our viewers and hopefully some potential patients?
So I think PT, if you think of what a physical therapist do, we do a ton of things. There's PTs for sports, geriatric, pediatric, literally pelvic health, women's health, everything. So even if you've had a bad experience, PTs are just like other professions. There's good ones and not so good ones. So I would ask you to give someone another chance, a different provider, kind of get a different perspective if you've been dealing with anything. I would say try to address injuries before they become really bigger, like much bigger injuries, like pay attention to your body. There's things that we can do to hopefully reduce your risk. So you don't always have to be hurt or have an injury to see a physical therapist. We want to get you before you get hurt, to minimize your time away from doing what you love to do. So PTs, we treat a lot of things. It's a lot about education. I want you off the table as soon as I can get you off the table. So these modalities are great, but the goal is to get you moving and back to life. So PTs, again, we do a lot of stuff. We collaborate with doctors, athletic trainers, training coaches. So it really is an interdisciplinary team. It's not just us. But yeah, it's an amazing field. We love getting people back to doing what they want to do. And I'd be more than happy to see if you need help.
Great. Thank you very much. I like that idea of getting back to life with physical therapy. So thank you very much. That wraps up our broadcast. Thank you so much to Rebecca Schumer, our physical therapist, as well as Kelly, our patient for the day. And thank you all for joining us and sharing your questions and being here for the broadcast. If you'd like to learn more or schedule an appointment, please call 844-91-GET-PT. That's 844-914-3878. We'll see you next time. Bye.